the current healthcare system is working extremely well. It's doing exactly what it is supposed to do for the people who own the system. So insurance companies charge you 10 times more for the same exact drug as they'll charge Canadians or Europeans, people in Japan. Fine. They're making record-breaking profits. What's the problem? The insurance companies make huge profits, pay their CEOs 30, 40, $50 million a year in salary. They do companies do massive stock buybacks for their investors. What's the problem? Working great. Anyone have a problem with that? And the only problem you might have is if you think that the function of healthcare is not to make huge profits for wealthy people, but to provide quality care for all. And by the way, most Americans believe that. So it's a long answer to a short question, but bottom line is we don't have a healthcare crisis. We have a political crisis. Last night, some of you may have heard President Biden in his farewell address talked about this country moving toward an oligarchy. He is right. You have a government that in no way, shape, or form is about representing ordinary people. It is funded by very powerful special interests, lobbyists all over the place, representing those corporate interests. And it is working. System is working great. Richest people become much richer. Corporate profits are soaring. Oh, by the way, our life expectancy is 5 years less than in other countries. If you're working class in this country, you live 7 or 8 years shorter lives than if you're rich. But who cares about that? The function of the system is to make money for people on top, and it's working. The only way it's going to change is when we have a political revolution, when tens of millions of people stand up and say, you know what? Not only do we need a healthcare system that works for all, we need a government that works for all, not just a few. So don't look at healthcare as separate from the climate crisis or many other aspects of our society. The current system is doing phenomenally well for the people on top. That's what it is designed to do. And if your parents die earlier than they should have because they couldn't get to a doctor on time, not their problem. It's your problem. And your job is to figure out a way you can amass the kind of political power we need to change politics in America.
I would like to return to the politics of this in a second, but I do want to pick up on something you said about other countries. We've all seen the struggles of the national health systems in Britain and Canada. Aren't those, in a sense, cautionary tales for subsidized private insurance? What do we learn from that, these systems that the left have long seen as models?
Well, what you learn is that you had a conservative party in the UK in power for many years, underfunding the NHS. You have a Labour Party, which is like the Democratic Party here, corporately dominated. But I would remind you that a few years ago, when the Conservatives were in power in the UK and they held an Olympics in London, I remember, their pride and joy, what they brought forth as something of enormous pride to the British people was their healthcare system. So is it struggling right now? Are there efforts by the oligarchs and the moneyed interests to privatize it, to move toward privatization? It is. But it remains something that the British people are very proud of. And I know that there are many of them who are trying to rebuild it, make it stronger. But at the end of the day, way back in the early 1950s, under the Labour Party in the UK, there was a guy named Nye Bevan. I don't know if that name means to anybody. He was the Minister of Health. And he said something which was very profound, not just for the UK, but I think for the entire world. He said that on a certain day, I don't remember, I think it was in 52, way back when, he said on that day, everybody in the country, you can go to any doctor you want, you go to any hospital you want, and you walk in the door and you don't have to pay for it. That was an extraordinary advancement for human civilization. The idea that anybody could get health care. And what happened is people came out of the woodwork. Women who had delayed their own treatments were coming out. People had no teeth in their mouth. They had factories that were running dentures, producing dentures 24/7. People flooding to the doctors because they previously could not afford it. It was an important day for human civilization. And given today, when we are so much richer in this country, than the UK was in 1952 after the war. There is no reason other than greed and politics why healthcare should not be a human right for all.
Well, I do want to give Dr. Fisher a chance to either respond to that or even ask a follow-up question of his own, but I just want to ask one thing about that. What evidence, candidly, do you have, sir, that Americans are willing to any more willing than Canadians or Britons, to pay more taxes to fund a system of what you're describing?
Because look, as somebody who's helped lead the effort in this country, ran for president twice on that issue, I know a little bit about the politics of it. And I know about the 30-second ads that were thrown against me and other proponents of Medicare for All. Right now, if you do a poll, and University of Chicago, I think, has polling capabilities, do it. And what you will find is that you ask two questions. Is healthcare a human right? Should be available to all? My guess is 75, 80% of the American people say yes. Now, we did a poll a few months ago. What do you think about Medicare for all? The majority of the people said yes. And that popularity for the program exists when you don't see this issue debated on television. You have never seen a program on television talking about Medicare for all. We're taking on the entire political establishment. We're taking on the insurance companies, the drug companies, the Republican Party, much of the Democratic Party. And yet, despite all of that, people understand how profoundly broken the current system is. So you're asking me, if we have the opportunity to explain to somebody that yes, you may pay more in taxes depending upon your income. If you're wealthier, you're going to pay a lot more. If you're poor, you're not going to pay any more. But you are not going to pay health insurance premiums. You're not going to have a deductible. You're not going to have a co-payment. Do you think people stay up night saying, oh, I hate paying taxes, but I love paying my health insurance premiums to United Health or Blue Cross Blue Shield? They don't. Now, we are outgunned on this like 100 to 1. Nobody very few of us talk about it. You have never, and correct me if I'm wrong. Let me ask the students there, faculty, anybody else. Have you ever seen a bloody program on television? One program that says, how does it happen that we spend twice as much per capita on healthcare as other countries and our outcomes are worse? Have you seen one program? CBS, NBC, Fox, you name it.
I think you have to ask them about YouTube. Doctor,
Yes.
do you have either a response to that or a follow-up for the senator? Before we go to questions soon, I have one more political question I want to ask, and I want to give you all an opportunity to engage with Senator Sanders and, of course, Dr. Fisher.
Yeah.
But I wondered if you had any response to that as a provider.
Well, I think one of the things he said that really resonates is we're the wealthiest nation the world has ever seen, and so we have the capacity to do great things if we so chose. I take care of people who predominantly are Medicaid or uninsured, and many of these insurance issues are sort of foreign to them. They get what they're given. I also take care of patients who reflect in their bodies the legacy of redlining, of predatory mortgages, of discriminatory hiring practices that leave them with a life expectancy here in Inglewood of 59 years compared to 90 years in the Gold Coast, who have the highest blood lead levels in the city are right around this area, and who, when COVID came, were ravaged and died much earlier than those who were able to work from home. And so I guess my question for the senator, and I'm so glad to have this forum with you, is even if we were to do this, what are the other things we would need to do in our society in order to ensure that not just our healthcare was more equitable, but we had different health itself? Those are things that happen where we live, learn, work, and play.
Thank you very much for asking that question. In fact, I just wrote a piece, I don't know where it was, one of the papers on that. And your point is very, very well taken. So let's back it up for a bit. Let's reflect on what the doctor just said. And that is, in the Illinois area, life expectancy varies significantly by income. That what you're saying, doctor?
By income and race.
And race, okay.
And sometimes they're disjointed. People with the same income of different races have different health outcomes.
All right, let me focus focus I've been working on is income. And what I will tell you, and I want you all to reflect upon this, it's not just that we live about 5 years shorter lives as a nation than most of the wealthy countries on earth. That's bad enough. But if you are working class in this country, you will live 7 or 8 years shorter lives than the rich. Now, why is that? Now, that's an extraordinary statement, which is never talked about, or very rarely talked about out of maybe medical circles. Why is that? And it begins to talk about some of the issues that the doctor raised. And that is poorer people, working class people live in unhealthier communities, more pollution. Poorer and working class people cannot afford decent quality food. And we got a food industry that is making billions selling our kids ultra processed food, leading to obesity, leading to diabetes, and other issues. And then there's another factor, and that is the issue of stress. And doctor, you jump in if you think I'm missing something here. But I want you all to think about, and this is, I think, what the doctor is talking about. If tomorrow you had free healthcare for all, which would be fantastic and would save lives right and left, it would not be enough. Mm-hmm. If you are out there and you're one of the 60% of Americans who are living paycheck to paycheck, you all know what that expression means? I grew up in a family that lived paycheck to paycheck. And what that means, you're working hard, and at the end of the month, you don't have anything in savings for what you have worked. It's just a struggle. And if your landlord raises your rent, you may have to move out of your house. And if your kid gets sick, you really don't know what to do. And if your car breaks down, it's a real crisis because you may not be able to get to work. You can't get to work. You can't get an income. You add all of that and more, you are living under enormous stress. Every single day is a struggle. And doctor, you correct me if I'm wrong, but my understanding is stress has an enormous impact on people's physical and mental health.
Totally agree. And I think that one thing to add to that is the good services and protections that allow for us to stay healthy are not randomly distributed.
Right.
The things that we need, like healthy food and clean air and security from weapons and jobs that nourish and opportunities to thrive, shape our bodies. Stress is one part of that, but anybody who has lived on McDonald's will know that it's not simply stress that makes us decay earlier. And so if we were to wave our magic wand and have a healthcare system that served us all, we would need to do a lot of things in order to reallocate some of these resources that we need to never need healthcare so that we can age gracefully.
Right.
Senator, I
I
want to
mean,
be
and
able to
that takes you to an economy, by the way, where right now you have tens of millions of people trying to survive on wages of $15, $14 an hour. Mm-hmm. And that leads to stress and all kinds of other unhealthy lifestyle. So the doctor makes a very important point. I mean, let's not minimize the need. If everybody in this country could walk into a doctor's office when he or she needed to, that would be a huge, huge step forward.
I want to be able to go to student questions. I just want to ask you this very quickly. It's really fast, but we've talked about all these different things. Democrats, we know, have done all they can to expand subsidies for insurance purchase, incentivize this is the last states to go into Medicaid under the ACA. The subsidy expansion is about to die. There's certain states that never did accept the ACA. And still, Republicans did clearly win the last election. So why have Democrats not been able to leverage, besides the problem on NBC and people not doing television programs, why have Democrats not been able to leverage this healthcare issue that so animates everybody across party lines?
Well,
Republicans had the last word.
It's a very good question. I think we just went through a presidential campaign where, by and large, healthcare was not discussed terribly much. And where Republicans didn't talk about it, and Democrats said, we are going to protect the Affordable Care Act and try to prevent cuts, rather than say, wait a minute, we got a system that is broken and we need to move towards something much, much better. To answer your question, I think in the world that I live in, which is the United States Senate, if you run for office from the state of Illinois, you're going to have to raise $50, $100 million. And you know where that money comes from? It will come from very wealthy, much of that money will come from wealthy and powerful special interests. And you don't bite the hand that feeds you. So it's a corrupt political system, which is in many ways, I'm not saying totally, related to the crisis in healthcare.
I want to make sure students get a chance to ask a question. I think you had your hand up.
Yeah.
Introduce yourself too, please.
So I'm Eduardo. Thank you. So my name is Eduardo. I'm a freshman, and I just arrived here in the U.S. So thank you very much for coming here and discussing this with us. This has the potential to be a very short answer, but I want to ask the question. Do you think you mentioned really briefly the role of, ultra-processed foods and the bad nutrition Americans have and how that affects the amount of times an American goes to a hospital and that kind of stuff. And so I was wondering if there's room for collaboration between the Democrats and a health department led by RFK, who made a really big part of his campaign saying, "Make America healthy again," and if that could impact health prices long term.
Well, I agree with RFK, just met with him the other day, that our food system is very, very unhealthy. On the other hand, what I'm sorry to have to tell you is that Mr. Kennedy is also a very strong critic of vaccines, which to my mind have saved millions and millions of lives and have said a whole lot of things that are not quite accurate. But I will tell you also that there are Republicans in the Congress who do understand that there's something wrong when so many of our kids and others are overweight, which leads to all sorts of health problems. So disease prevention, keeping people healthy, taking on the food industry to help to demand that they produce healthier food is a very high priority of many of us.
Will you vote for him, Senator, if he comes to
Pardon
the
me?
floor? Will you vote for RFK Jr. if he makes it to the floor?
Well, I'm going to answer the question the way I've answered your question, the way I've answered it to the media. There is a process. We haven't had a hearing yet.
Okay, sir. Question here?
Hi, I'm Davis. I'm a third-year undergrad. I guess my question pertains to the cost of drugs. I'm curious what you think the future might be for some of the IRA provisions like the MD, PNP, or if you think that Biden made a mistake by not necessarily leveraging margin rights effectively to negotiate the cost of drugs even lower, and perhaps how that might flip in a Trump administration.
This is an issue I've worked very hard on. I am proud that we helped lead the effort along with the Biden administration in lowering the cost of asthma for seniors. I'm proud that, lowering the price of insulin for seniors. We have also worked hard with some success in lowering the cost of asthma inhalers, which is a big deal. Put a cap of what seniors will pay for prescription drugs, people on Medicare, at $2,000. And most importantly, and Biden deserves a lot of credit for that, for the first time in history, the United States government will be beginning to do what every other major country does and start negotiating prices. As a matter of fact, tomorrow they're going to list 15 more drugs that they are negotiating prices with. That's the very first time that that has happened. I believe that that will result in significantly lower drug prices over the years. Bottom line, in my view, while I think Biden and his people did more than any other administration in history on this issue, Trump talked about it a whole lot, but he did virtually nothing when he was president. We've got to do a lot more. It is absurd that people are dying or get sick because they cannot afford a drug which might cost 10 times more in this country than it does in other countries. That is absolutely unacceptable. So I would have hoped that the Biden administration would have been even more aggressive, but they do deserve credit for at least beginning to take on a very, very powerful industry, and that is the pharmaceutical companies.
Do we have any questions on this side of the room? Was that in the back there? In the back?
Hi, my name is Janaya. I'm a third year pre-med and neuroscience student, and this can go for either Dr. Fisher or Senator Burney. And I was wondering, what is some advice that you'd give to like an aspiring physician who's grappling with these political, systemic, and environmental issues? Because of course, as a physician, you're not only treating just the patient, you're treating their mental, physical, emotional well-being, and all these different factors in the external world that goes with that. So I was wondering if you had any advice.
Why don't I start with some of the journey to becoming a physician, which I know is long and arduous, and we need you. Thank you for beginning that journey because we all need more physicians. We all get sick at some point in time, and I think that to the extent that you maintain your own humanity in the process, you'll be able to see these issues more clearly and become a better advocate not only for your patients, but for addressing some of these larger systemic issues. I think it requires that you often step back, and much of what we do as physicians is one-on-one. A lot of what we do is hold patients responsible for their care, for showing up, for wearing their masks, for doing all of these individual things when in fact they're working within a system, within a context that makes them ill, that stands in the way of their care. Maintaining that perspective is going to be important. You're gathering it now, and in college, you'll hear more about it in medical school. You'll need peers on your journey to ensure that you all hold each other to account, to ensure that you center the people that you're caring for in that process, and never blame the victims. And usually it's the person in front of you who is being victimized by systems rather than, you know, if only you had done something different in their care process. So that'd be my advice.
Well, I agree with what Dr. Fisher said, but I would add something to it, not to make your difficult life as a medical student even more difficult. But we need your help. We are right now, I should tell you, mounting a campaign which we'll be working on for the next several months to mobilize people all over the country on a healthcare is a human right campaign. We think there's a lot of support out there if effectively mobilized and organized. And I and other politicians, and there are a number of us who believe in things like Medicare for all, but doctors and nurses are far more effective advocates for Medicare for all than I can be. Because when we have nurses and doctors go forward and say, you know what, I was trained and spent years studying to try to help my patients. And where I am functioning in a system where people are walking in the door months after they should have walked in the door, or I cannot prescribe a prescription drug for them because they cannot afford it. Or I have insurance companies leaning over me, telling me what kind of treatment I can provide. We need you to say my job as a physician is to provide the best quality care for all of our people, not to make money for the insurance companies and the drug companies. And I cannot do that job under a current system that is based on greed and is broken. So we need, and we're going out. I mean, there are many, many doctors as an organization called PNHP, Physicians for National Health Program, and then many, many doctors, a lot of young doctors, nurses, National Nurses Union, largest nurses union in the country, strong advocate for Medicare for all. But we need people in the profession to stand up and say, you know what? I'm proud to be a doctor, I'm proud to be a nurse, but I can't do my job under a broken system.
Senator, do you have time for one more?
One more.
Hi, Senator. Thank you for being here. I'm Jacob. I'm a fourth year here. I wanted to ask you about the cultural reaction we're seeing to Luigi Mangione, because we've seen an outpouring of support for him online, like praising him as a working class hero, and not that everybody who's reacting to this supports murder and condones violence, but I think a lot of people like understand the frustration and anger that might led him to do this. So I'm curious, like, what you make of that reaction from like everyday people, but also the reaction from some of your peers in Congress, for instance, who seem to be completely oblivious as to why anybody would be so driven by anger to murder somebody. And Dr. Fisher, feel free to weigh in.
Let's be clear. You're not going to solve the healthcare crisis or any other crisis by shooting somebody in the back, whether it's an insurance executive or anybody else. So I condemn, that act and any other form of violence. But what you have seen online is people's reaction to the health insurance industry. where people have been rejected for claims that they desperately needed. And there is anger against the insurance industry. You know, if you just, it doesn't take, you know, a PhD in economics to figure this out. If the goal of the insurance company is to make as much money as possible, the more claims they reject, the more money they make. And that's what they do. And they use artificial intelligence to help them along their merry way, where they tell doctors what they can do and not, or what drugs they can or cannot prescribe. So I think what that outpouring of anger online showed is the real frustration and disgust that millions of people have with an industry who puts profit over the needs of American patients. So, you know, and I think you're seeing that anger all over the place in many ways. And I think what we've got to do now is not go around killing people. What we've got to do is channel that anger into a political movement which says healthcare is a human right. We're going to do what is not radical. It's what every other major country does. I live 50 miles away from Canada in Burlington, Vermont. Somehow or another, they spend maybe half of what we do, provide healthcare to all of their people. Their system is not perfect, no perfect system on earth, but it is better than ours and far less expensive than ours.
Well, Senator, it was very generous of you to give a half an hour of your time. We hope you come in person sometime. You're used to the weather here, so that's not an excuse. We love to welcome you back, welcome you to campus in person again, and thank you so much for joining us on this very important question today. Students, Dr. Fisher can probably stick around for a few more if you want to ask some questions, and as usual, we are so glad you came, and we hope you come to all of our events, and our fellows start in a couple weeks, so check out the fellow seminar schedule as well. And thank you again, Senator, for being here.
Thank you all very much.